All right, today I want to talk to you guys about knee pain and hip pain. This is extremely common. In fact, most of my clients that were north of 35 years old suffered from some sort of knee or hip pain. And more often than not, it was related to the IT band. And the IT band is this fascia that runs from the hip all the way down and inserts in the front of the patella. So if this is the issue for you, most commonly you'll feel a little bit of pain in the front of your knee, or it'll feel like someone is sticking a knife in your hip up here. It's most common that my runners and people that do exercises, endurance athletes, will typically feel it in their knee more often. And then my clients with like low back issues and advanced age tend to be more hip related. I personally suffer from hip issues. And the foam roll is a great tool for you to eliminate this pain temporarily. And as a trainer for a long time, I made the mistake of using this as a crutch for my clients. I would address the pain, alleviate it, and then it would just keep coming back. And it was this vicious cycle that we never seemed to get to the root cause. And that was because I wasn't addressing the root cause of the pain. And the root cause of the pain is caused in the instability and mobility in the hips. Because the hips are not strong and have good mobility and strength and control like they should, what ends up happening is that fascia, that IT band, ends up taking on a lot of the stress and gets really tight. That really tight feeling then feels like a pulling sensation or a pain in the front of the knee, or that pulling sensation in the hip area, and causes a lot of pain. So the first thing that I want to do is I first wanted to address the pain right away by doing the foam roll. So I want to teach you guys how to properly foam roll the area to give it temporary relief. And then let's go over a few exercises to strengthen and work on the mobility so we eliminate this problem forever. All right, so we're going to address the pain in your hip or in your knee by temporary relief first with the foam roll. So the first thing I want to do is teach you how to foam roll properly. And then we'll get into the exercises that you need to do to make sure we permanently get rid of this hip or knee pain. So with the foam roll, I want to lay it flat on the ground, and then I'm going to start at my hip. So we are going to roll that whole IT area that I was talking about from the hip all the way down to the knee. That's the area that we're going to be covering, the surface area. I'm going to lay on my side starting up at the hip. I want to take so the bottom leg is going to be laid out straight, and then the opposite leg I'm going to cross over. And really what this is for is to take some of the pressure off. So if this is really bad, some people, just the pressure and the weight of their body on the foam roll will feel really, really tough for you. Now, if it is, this is just another reason why this is an area that you need to address. Sometimes when it is really, really tight, just putting your body weight on here will cause a lot of pain in the hip and the knee, which is just another sign that that's a really bad area for you and we need to address it. But to alleviate some of it, what you can do is you can cross it over. I'm going to use the opposite hand and arm for support, and that can take some of the pressure off. So when I get in there is going to be some discomfort. That's totally normal. I'm going to start at the hip, and then I'm going to slowly walk my way down until I find those areas that are sensitive. When I find a sensitive area like that, that'll cause a little bit of sharp pain in the hip area, I'm gonna stay there and focus on my breathing. Real deep breaths in through the nose, exhale through your mouth, and really try and relax the body and calm it down. That's what we're trying to do, is calm the central nervous system down right now. And so really focus on your breathing. And when you find an area like that, stay in that area for a solid 30 seconds to a minute before you move further down the leg. And then you want to just keep slowly working your way down until you get all the way down to the knee. Find those areas that are problematic, stay in those areas, focus on the breathing, relax the body. And sometimes you might want to roll forward a tiny bit, rock backwards. You'll see that you'll find different areas that are going to be tighter in area. If it's not tight, it doesn't bother you, move along from it and keep moving your way down and up the IT until you find those areas that are problematic, and then stay in them, breathe, 30 seconds to a minute, work that area out before you move on to the next. We'll do that on one side, and then we'll flip over to the other side. For those of you that it isn't really painful, you may be able to take your feet and put all of your weight. Now, this is a good goal for us. So if you are at a place where it's very painful, even with you taking some of your weight off of there, you would like to get to a place where you can actually roll up and down the IT without this being extremely painful. And that's when you know you've made some progress in this area. So now that we have addressed the temporary pain by foam rolling and calming the central nervous system down, the next thing that we want to do is work on mobility in the hip. So we're going to do a mobility exercise, one of my favorite for the hips, which is the 90-90 and their variations. And then we'll move into some exercises to strengthen that range of motion. So first we need to find that new range of motion. We'll do that through a 90-90. It's called a 90-90 because of the way we are positioned. The front knee is at a 90-degree angle. The trail leg that's lined up with your shoulders and hips is at a 90-degree angle. I'm going to use the opposite hand. I'm going to supinate it, so turn it to where palm is facing towards you, and then use that to kind of prop myself upright. So here is the starting position. I want to think about my posture. I want to sit up tall and straight with the chest up nice and high. And what we are working on is internal and external rotation of the hip. So we are putting the hips in this extreme external and internal rotation. And now I want to try and intrinsically connect to it. So that's part of the deal. Part of why we're getting the pain in the IT band is because we lack the stability and control in the hip. And the idea of this exercise is to intrinsically get connected back to that full range of motion in the hip. And so we put you in these extreme internal and external rotation of it. So we're in that position now. And then once we're in the position, I want to connect to the hips. So, and the way I'm going to connect is I'm going to lean over just a tiny bit, propping the chest up, keeping good posture. When you do that, you're going to feel kind of a stretch back here in the butt area. And then I want to think about pushing the knee into the grass. So I'm pushing down, I'm connecting to all those muscles surrounding the hip and controlling it from rotating, and I'm going to drive it into the grass. And I'm going to drive as hard as I can for about 5 seconds. Then I'm going to relax, come all the way out of the stretch again. Then I'm going to move back into the stretch. Once I'm in the stretch position, again, thinking about connecting, driving the knee into the grass, hard 5 seconds. Make sure you're breathing normal. Don't hold your breath. After you do that for 5 seconds, relax, come out of it. I'm going to do that 5 times on this side, and then we'll switch over and do 5 on the opposite side. And the key to this, you may notice a discrepancy from left to right. In my case, it's more challenging on my right side. Make sure you start off by propping up with good posture. Same thing, looking at your cues. My knees are bent at 90 degrees. My trail leg, I'm gonna make sure it's lined up. My shoulders, my hips, my knee, all aligned. And then I'm gonna lean over into that stretch. Once I'm in the stretch position, I'm again thinking about that knee, and I'm trying to drive it into the grass. So drive it into the grass, connect to those muscles back there in the hip, push hard for 5 seconds, make sure we're breathing normal. After those 5 seconds, relax, and then move out of it. Do that on each side a good 5 times, maybe 2 to 3 rounds before you get into your regular exercises. All right, so we just finished with the 90-90, and the goal of that was to get intrinsically connected to those muscles. And now we've done the good job of doing that. Now we want to work on stability, strength, and control of those muscles around the hip. So one of my favorite exercises for this is the assisted Miguel planes. And so the goal of this is we are now having to stabilize on one leg. And then in addition to that, we are working on strength and control of all those muscles surrounding the hip. So we've done the mobility work now to get reconnected. Now let's work on stability and strength. When we do this exercise, I'm balancing on one leg. The bar is just there for assistance. I'm going to kick one leg back, and the idea, what I'm trying to do right here, is to open the hips up. So we're using the stability on the one leg. We're also using the weight of my opposite leg and my hips to use for us to build some strength. And I just want to move real slow and controlled. I open up until I find that in range of motion. I'm going to intensify it at the end for a few seconds, then slowly resist on the way back to that starting position, then open back up, find that in range of motion, and then slowly reset. I'm gonna do that 5 times on each leg before I move into our final exercise. All right, final exercise that I wanna teach you guys. These are your traditional tube walks. Now, we have worked on the mobility and getting connected to those muscles by doing the 90-90. We then moved over to your Miguel planes, where we worked on some stability, control, and strength. And now we're gonna do just a pure strength exercise for the hips. I love this. Very simple. These bands, you can get them on Amazon. We sell them in our Mind Pump store. They're really cheap, really basic. I'm gonna step into the band. I want to actually put the band just above my knees. So they're above my knees. I want my feet a little bit wider than shoulder width apart. You'll feel already the band is trying to collapse the knees inward. I want to fight that by pushing the knees out, keeping tension there. And then I'm going to walk out to the left 10 times, walk back right. So I'm just going to take a good step, keeping the knees from collapsing in, step out, step out. I'm going to walk to the left 10 times, and then I'm going to walk back to the right 10 times. I'm going to do this for 3 rounds after I do the 2 exercises that I just showed you before that. Hopefully these 3 things will help alleviate that knee or hip pain.